Welcome back. One woman from Florida explains what it's like to survive COVID, only to find out that she was losing her hair. Jenna Brew reports.
It's a different kind of coronavirus covering. Anne-Reen Rowe removes her wig, unmasking what COVID took from her. Rowe battled the virus in April.
I was in the hospital for 12 days.
Her recovery from the virus has left lingering symptoms. Arguably the most jarring of all to Rowe, her loss of locks.
I would brush my hair and go like this, and it would fall in the drain, or it was in the towel or in the sink. And I probably lost about 75% of my hair.
The emotional toll some days unbearable.
Oh, I was so depressed. I was so sad, and I was crying.
While this seemingly delayed symptom of COVID-19 is understandably difficult to those experiencing it, dermatologist David Sachs explains the temporary hair loss condition is known as telogen effluvium.
And telogen effluvium is not unique to COVID. Stress is probably the main thing. And I can't imagine why anybody would be stressed during the pandemic, right? That doesn't make any sense.
Lighthearted sarcasm aside, Dr. Sachs says the diagnosis isn't all bad.
There's a growth phase, there's a resting phase, and there's a phase where the hairs actually start to shed out of the scalp. And fortunately, even after the hair starts to shed out, the new hair that grows in will start to cycle normally. And that's why I said it's reversible. It's even if we do nothing, it starts to grow back on its own.
Rowe's advice?
Start looking for some wigs and try to have, find a silver lining in it and try to have fun.
And the American Academy of Pediatrics says that since the start of the pandemic in March, 14% of parents reported worsening behavioral health for their children. This change is linked to a disturbance in routine and isolation from their peers. Across the country, 73% of school districts offer social and emotional learning programs, which have been linked to improved behavior, relationships, and grades. Since many kids aren't physically in school, there are barriers to getting those resources. And a new study is suggesting certain types of COVID-19 survivors may be better donors of convalescent plasma. Scientists from Johns Hopkins University examined samples from plasma and 126 recovered COVID-19 patients. They found older men and those who were hospitalized with more severe disease were more likely to have stronger antibody responses. Clinical trials for using convalescent plasma and treating COVID-19 are ongoing.